Hi viewer, how are you? This is Dr. Shabir Khan with Watch and Know YouTube channel. Today our topic is mesothelioma, diagnosis and its treatment. First of all, diagnosis. If you have signs and symptoms that might indicate mesothelioma, your doctor will conduct a physical exam to check for any lumps or other unusual signs. Your doctor may order imaging scans such as a chest X-ray and a computerized tomography CT scan of your chest or abdomen to look for abnormalities. Based on the findings, you may undergo further testing to determine whether mesothelioma or another disease is causing your symptoms. Diagnosis uh, include, first of all, biopsy. Biopsy a procedure to remove a small portion of tissue for laboratory examination is the only way to determine whether you have mesothelioma. Depending on what area of your body is affected, your doctor selects the right biopsy procedure for you. Other options include inserting a needle through the skin. The doctor might remove fluid or a piece of tissue with a thin needle inserted through the skin on your chest or abdomen and collecting a sample of tissue during surgery. A fluid or tissue sample might be collected during an operation. The surgeon might make a small incision or insert a tube with a video camera to see inside your chest or abdomen. Special tools can be passed through the tube to collect a tissue sample. The tissue sample is analyzed under a microscope to see whether the abdominal tissue is mesothelioma and what type of cells are involved. The type of mesothelioma you have determines your treatment plan and determining the extent of cancer. Once your mesothelioma is confirmed, your doctor may recommend additional tests to understand whether your cancer has spread to your or lymph nodes or to other areas of your body. Tests may include number one, CT scans of chest and abdomen. Number two, magnetic resonance imaging (MRI), and number three, position emission tomography (PET). Your doctor determines which tests are appropriate for you. Not every person needs every test. Your doctor uses the information from these tests to assign your cancer or stage. The stages of pleural mesothelioma are indicated using Roman numerals ranging from 1 to 6. A lower numeral means the cancer is most likely to be localized to the area around the lungs. And the highest numeral means the cancer has spread to the other areas of the body. The cancer staging system. The cancer staging system continues to evolve and is becoming more complex as doctors improve cancer diagnosis and treatment. Your doctor uses your cancer stage to select the treatment that are right for you. Pharmaceuticals are not available for other types of mesothelioma. Now is treatment. I will tell you about treatment of mesothelioma. What treatment you undergo for mesothelioma depends on your health and certain aspects of your cancer, such as its stage and location. Unfortunately, mesothelioma often is a aggressive disease and for most people a cure is not possible. Mesothelioma is usually diagnosed at an advanced stage when it is not possible to remove the cancer through an operation. Instead, your doctor may want to control your cancer to make you more comfortable. Discuss treatment goals with your doctor. Some people want to do everything they can to treat their cancer. That means ending side effects of some else, chance of an improvement. Others prefer treatments that make them comfortable so that they can live their remaining time as symptoms free as possible. Next is surgery. Surgeons want to remove mesothelioma when it is diagnosed at an early stage. In some cases, this may cure the cancer. Most of the time, it is not possible to remove all the cancer. In this situation, surgery may help to reduce the signs and symptoms caused by mesothelioma spreading in your body. Surgical options are number one, surgery to decrease fluid build up. Pleural mesothelioma may cause fluid to build up in your chest, causing difficulty breathing. Surgeons insert a tube or catheter into your chest to drain the fluid. Doctors may also inject medicine into your chest to prevent fluid from returning. Number two is surgery to remove the tissue around the lungs. Surgeons may remove the tissue lining the ribs and lungs. This procedure would not cure mesothelioma, but but may relieve signs and symptoms. Number three, surgery to remove lung and surrounding tissue. Removing the affected lungs and the tissue that surrounds it may relieve signs and symptoms of pleural mesothelioma. If you will be receiving radiation therapy to the chest after surgery, this procedure also allows doctor to use higher doses since they would not need to worry about protecting your lungs from damaging radiation. Number four is surgery for peritoneal mesothelioma. Peritoneal mesothelioma is sometimes treated with surgery to remove as much of the cancer as possible. Chemotherapy may be used before or after surgery. Chemotherapy. Chemotherapy uses chemicals to kill cancer cells. Systemic chemotherapy travels throughout the body and may shrink or slow the growth of mesothelioma that can not be removed using surgery. Chemotherapy may also be used before surgery to make an operation easier or after surgery to reduce the chance that cancer will return. Chemotherapy drugs may also be heated and administered directly into the abdominal cavity in the case of peritoneal mesothelioma. Radiation therapy. Radiation therapy focuses high energy beams from sources such as X-ray and protons to a specific spot or spots on your body. Radiation may be used after surgery to kill any remaining cancer cells. It may also help reduce signs and symptoms of advanced cancer in situations where surgery is not an option. Other treatments are in certain situations. Other treatments might be used to treat mesothelioma. Other treatments include number one is immunotherapy. Immunotherapy uses your immune system to fight cancer. Your body's disease-fighting immune system may not attack your cancer because the cancer cells produce proteins that blind the immune system cells. Immunotherapy works by interfering with that process. This treatment might be an option if other treatments are not working. Number two is targeted therapy. Targeted therapy uses drugs that attack specific or vulnerability in cancer cells. These drugs are not commonly used for treating mesothelioma, but your doctor might recommend targeted therapy based on the results of tumor DNA testing. Clinical trials are study of new mesothelioma treatment methods. People with mesothelioma may opt for a clinical trial for a chance to try new types of treatment. However, a cure is not guaranteed. Carefully consider your treatment options and talk to your doctor about what clinical trials are open to you. Your participation in a clinical trial may help doctors better understand how to treat mesothelioma in the future. Clinical trials are currently investigating a number of new approaches to mesothelioma treatment, including new targeted therapy drugs and new approaches to immunotherapy. Treatment for other types of mesothelioma, pericortical mesothelioma, and mesothelioma of tunica vegetalis or varia. Early stages cancer may be removed through surgery. Doctors have yet to determine the best way to treat later stage cancers, though your doctor may recommend other treatments to improve your quality of life or future. Hope you have been informed well about mesothelioma, diagnosis and treatment. Thank you for watching the video. Take care. See you.